There was a report recently that more than a third of Quebec toddlers contracted at least 10 infections before the age of 3. Sounded serious, but how concerned should parents be? Dr. Donald Vinh is an infectious disease specialist at the MUHC. Hi, Don.
Hi, Ms. Sumi.
So a third of toddlers getting all these infections. What did you think when you heard about this study?
So my first thought was that this is a useful public health signal, but it needs context. So parents should pay attention, but not panic. The Quebec data show that by age 2.5, 36% of toddlers had at least 10 infections over 2 years. That sounds dramatic, but in toddlers, especially those in daycare and group settings, frequent viral infections are actually quite common. And anybody who's had a child in daycare knows about daycareitis. But I think the more important signal is how do we reduce the impact of infections in children? Most are mild, but some can lead to serious complications like pneumonia requiring hospitalization or dehydration from gastroenteritis. And there can also be longer term effects, such as worsening asthma after viral infections or recurrent ear infections that decrease hearing. So with these high rates of infection in children, the focus should be on prevention of infections and mitigating the consequences of those infections.
Is getting sick, colds, exposure to bacteria, viruses somehow useful? I've heard parents say that, they want their children to develop their immune systems. They want their child to get chickenpox, they say, just to get it over with.
Yeah, so let's be clear. Getting infections is not a wellness strategy. Let's not forget, throughout most of human history, getting infections was actually the main cause of death, with about 1 in 4 children dying before their 5th birthday, mainly from infections like pneumonia or diarrheal diseases. What changed that was not people getting sick to try and strengthen their immune systems. It was public health measures like hygiene and vaccines to prevent people from getting sick in the first place, as well as antibiotics. So while the immune system does learn from exposure, that does not mean infections are beneficial or something we should just try to get over with. The chickenpox is a good example. It can lead to serious complications like skin infections, pneumonia, brain infections, or even death. Since we cannot predict who will develop these complications, why take the gamble in the first place? Vaccination allows children to develop immunity without paying the price of the disease itself. So if we have a safe way to build protection, that's always the better choice.
But Don, we talk about having to build up our immune systems, but what exactly does that mean? I mean, can it be done?
Building up our immune system is a catchy phrase, but medically it's an oversimplification. The immune system isn't a muscle that gets stronger just because you catch more infections and diseases. That's like saying you're going to strengthen your liver by drinking a lot of alcohol every day. In reality, the immune system is constantly encountering microbes daily through the air we breathe, the food we eat, and the surfaces we touch. And it's continually building its immune repertoire through those exposures. We don't need to get sick in order to train our immune system. And the flip side is also important. Reducing exposure to pathogens doesn't make the immune system weak. If that were true, people returning from long periods of isolation, like astronauts coming back from space or submarine crews after months underwater, would be constantly getting infections upon the return, but that's not what we see. So if you want to make your immune system stronger, good nutrition, healthy living, and vaccines are the exercise drills that'll get you there.
But Don, do some people just have a naturally better way to fight disease, a better immune system?
Yeah, so this is a topic that I really love. The reality is that there's a lot of natural variation in how people's immune systems work. Some people have underlying medical conditions or take medications that make them more prone to infections. But even among people who don't have these conditions or medications, there is still important variation shaped by our genetics, our environment, and how our immune systems develop over time. And it's not black and white. There aren't superheroes with a perfect immune system that protects them from everything. Instead, for any given germ, some people may not get infected at all or may have very mild illness, while others can become quite sick from the exact same infection. And understanding why that happens is exactly what my team studies in my clinic and in my research lab.
So at the end of the day, Don, and very quickly because we're almost out of time, obviously it's not realistic to not get sick at all, but is there a good way not to get sick? I mean, vaccines aside?
Well, you're right. We can't avoid all exposures. So the goal is to lower risk, not chase perfection. And we do that through strong science, improving ventilation, good hand hygiene, safe food and water, as you said, capitalizing on the vaccines that we have. And if I could be so bold, consideration of others. I think that's how we get our communities healthy.
Okay. Thank you very much for this, Don.
Thank you, Mitsumi.